Here's another case that you should find very astonishing. Shirley with Arnold-Chiari Formation. Arnold-Chiari Formation. That means the tonsils of the brain are coming through the foramen magnum. There's a hole at the base of your brain where your spinal goes through. That's called the foramen magnum. And when part of the brain starts to come through there, they operate the base of the brain and open up the foramen magnum, they'll enlarge the base of the brain, a hole there, and they cut off the rear section of the first vertebra. All right, she had migraine headaches for 20 years, paresthesis in the right hand for 30 years, and pains in her neck for 20 years. She was referred to Mayo Clinic for this type of surgery. Just before she went to Mayo Clinic, her father-in-law sent her over to my office. I asked him to. In fact, I begged him to. All her symptoms cleared in 8 weeks. She was holding her first adjustment. There's an Arnold-Chiari questionnaire formation, all right? And here is a questionnaire we gave her. We had it in our office, and you'll find that most of the things she said were positive where she had the Arnold-Chiari Formation. Now, she filled out another questionnaire later on. The symptoms were negative. And mind you, she said, not since she came to see Dr. Dickholtz. All these symptoms cleared up to, and it's, in other words, we use this, we do everything we can to prove that we are using a science. This is questionnaire 3 months after the first adjustment. This is her lateral x-ray. I want you to notice on lateral film here, the exostosis on the, second, third, fourth, fifth vertebra. Look at the neck falling forward. Why do people have this exostosis? Why do the vertebrae change shape? I don't know if the medical doctors looked at it but if that neck was in the vertical axis, could you see the weight would be falling on the pre and post sig apophyses? Where the weight falls forward, the vertebra is going to change shape. When I see this much exostosis, the vertebra change shape, I got to say there's 35 years of damage there. As far as I'm concerned, her head was twisted on delivery, and this was caused her spinous to be twisted this way, and her spine to be out of balance and twisted this way. These are her x-rays before and after. She had atlas lateralis 3 degrees, and the atlas was reduced down to 0. In other words, we moved the atlas underneath the skull. Took the stress out the base of the brain, using the measurements the way we measure x-rays. This is what's called the vertex. And these are what we call proper vertex films. All right? The atlas it was off to the right side, anterior half degree, and after we adjusted the patient, it came down to 0. In other words, we use lead filters here. There's 9,000 lead here, 6,000 lead here, 60,000 lead on the side. We have a chin center device over here that centers the chin. The gabella's on center. The shoulders are on center. The butt is on center. These are perfect vertex films.